to death.
Many women still rely on untrained TBAs or traditional birth attendants. They are found in every village and community throughout Sierra Leone and offer a cheaper alternative to the modern healthcare which the government promised would be free.
It's sweating free. It's sweating free. It's a free. Kaburanians.
Dr. Bundu runs the Makeni Hospital. He believes that there are three main reasons for the death of so many pregnant women: the delay in seeking medical care, the delay in reaching a hospital, and finally, the delay in receiving adequate treatment when they arrive.
One of the reasons for first delay might be the fear in the people that they are going to be asked to pay in the hospital for services. They go to alternative sources who are not trained, but they have the confidence of the local people. Nationwide, if we do it by district, Bombali has the lowest maternal mortality, thanks to massive support from the reproductive health sponsored by the UN agencies, like UNFPA. They are giving us drugs, they are giving us surgical sundries, and they are giving us incentives so that to motivate the staff and work effectively. They don't have to pay for care.
Dr. Bundu's hospital is the exception rather than the rule because he receives additional UN funding. But most other hospitals and health centers aren't so fortunate. Janet and Fatmata run a government health center. Without proper funding, they face an uphill struggle to encourage women to come to them for treatment.
So many pregnant women come here for antenatal clinics. They come for checkup, they come for examinations. We used to give them their routines. Of course, some don't come because of ignorance also. Some usually say we don't have money. But as long as they are pregnant women, we used to tell them, come, even if you don't have money.
Some even refuse to come again, saying, I don't have money unless you go to their houses. And okay, come and let's go.
Come, let's go. Come, let's go. Mm-hmm. Go for your drugs.
I've not been paid for the past 3 years now almost. I've not been paid a single cent. Well, I've been surviving through patients by the little amounts they give after buying drugs and stationaries. What is left we use.
Healthcare is supposed to be free, more for pregnant women, under 5s, and vulnerable people. But we used to ask for money because we are not paid. Sometimes, whenever they don't have, we treat them just to save life. We know we are fighting to save 2 lives.
Tired of seeing so many women die and tired of waiting for the government to act, communities like this one have set up their own savings scheme to cover the cost of emergency maternity care.
Okay, and the women there and the police there, now the meeting don't start. If anybody talk, I'm going to lie, anybody make side talk, them picking let them come on here. Anybody will not get please? Let them come here. Want law man sit down.
While the government is encouraging schemes like this one, for people who have so little in the first place, this is an additional burden they can ill afford. The real answer is for the government to act on its promise to provide free healthcare for all pregnant women. Dr. Samuel Kabo is the director of the Reproductive Health Program at the Ministry of Health.
Before the war, we had about 500 to 600 doctors working in government. After the war, we had less than 100. They all went away because of the poor salaries. So what we say, what do you want to do? You improve the salaries and a lot of them will come back. Some of the staff are so poorly paid. Some of them do not get a salary at all. A lot of them are volunteers. And so where they depend or what they depend actually on is what they get out of their work on a daily basis. When they go, what patients pay them, that is what they depend on. I'm a doctor. In the district where I was working, there was a time I was the only doctor for months at a time. I was a physician, I was the surgeon, I was the pediatrician, I was the public health surgeon, I was the administrator. And then you are so poorly paid. And then you ask me if you will not want to have these people pay you so that you can be able to take care of yourself and your family. So this is important for us. In as much as we want to help the hospital, we want to help the women directly, but I think one of the ways that we can help them is that if we can get these staff well remunerated, then we can have a hold on them, have them accountable to us, then they can be able to deliver services.
But the question remains, why isn't the government prioritizing women's health when most of those who die giving birth in Sierra Leone could have been saved with the necessary care? Women like Issa Cole want the Sierra Leonean government to take steps to ensure that all women enjoy their right to life.
The human rights has to come in at some places, as well as the government need to come in also. We ourselves, the women, need to advocate for ourselves that we are suffering. We are dying because of lack of knowledge. We are dying because we are poor. We are dying because it looks as if there is no one that is hearing our stories.